This 17-year-old patient was referred to me yesterday for endodontic retreatment of tooth number 30. According to the patient and the mother, the root canal was done originally about 3 years ago by patient's GP and crowned. A few days ago, according to mother drops off her son at the dentist and leaves to run some errands, and mom claims that she got a phone call from the dentist office saying that they were going to work on tooth number 30, and mom wasn't sure what they were talking about, but she said, okay, go ahead. So she gave permission and didn't think of it much. Mom claims that when she went back, she saw that tooth number 30, the dentist was trying to redo the root canal that she had done originally approximately 3 years ago. And mom started asking questions, what's going on, why? And the dentist said that tooth was abscessed. That's why she wanted to redo the root canal. And unfortunately, she couldn't redo the root canal. She told mom that she had tried and couldn't redo the root canal, and now they needed to go see an endodontist. So mom was very upset with the GP. And when they got home, everything according to mom was fine. According to the patient, everything was fine. And then a couple of days later, he started to have a lot of pain, and then his face became all swollen up, and there was so much pain that he basically, poor kid, mom was saying that he was crying. It was that much pain. So they go back to the dentist, and the dentist puts them on antibiotics and refers them to us. And that's when we saw him yesterday. And this was the condition of the tooth. Tooth now has a temporary crown on it. That's a temporary crown, and you can see the work that this dentist was trying to fix her own root canal. So we requested x-rays from the dentist from before she had done the root canal on this tooth. And the reason for the root canal 3 years ago was there was a cavity, and the cavity was a little too close to the nerve of the tooth, so the dentist recommended a root canal. So that tells me that there was no infection when the dentist did the root canal. It was a vital pulp, so somehow bacteria got in. So I was curious to see the radiographs from 3 years ago before the dentist had done the root canal on this tooth, and we got those radiographs, and let's look at them together. This looks like mid-treatment. I can see a rubber dam clamp, so that's a great sign. And again, you can see that there was no periapical lucency associated with this tooth in 2022 when this root canal was done, so about 3 years ago. Another angulation, and you can see that there's another canal. And you can see there was another canal here that somehow gutta-percha got in from the other distal canal that this dentist was able to locate. All right. And this was the radiographs that the dentist took the other day before she referred the patient to us, but you can see that she had tried to redo the root canal here. So she had tried to remove the gutta-percha, and I think she just got stuck because she very likely didn't know how to remove the gutta-percha. It looks like she was trying to remove the gutta-percha with files, maybe gates, I don't know. But in the process of doing so, now she has thinned out these walls. So this is what we have to unfortunately deal with. I don't know what's going on here, but you can see the mid-distal canal there. Periapical lucency. So it looks like this dentist, she took a bite bigger than her own mouth. Unfortunately, this was not a case for her to practice on. Shouldn't have practiced on her patient. You either know how to redo a root canal or you don't. So she should have just referred to us. Now we don't know what we're dealing with here with this tooth. So I went over options with the patient and his mother, and they really wanted me to try to see if we can save this tooth. This patient was referred to me for endodontic retreatment of tooth number 15. According to the patient, this root canal was done about 5 years ago. And recently, she had her teeth cleaned a few days ago, and patient says afterwards, tooth started to act up, and she noticed a blister on her gum. And she was in a lot of pain also. And on top of that, she had developed trismus. And on top of that, she was going out of the country in 5 days. So she came to see me for endodontic retreatment of this tooth number 15. So you can see the previous root canal, and you can see the large periapical lucency here. Short fills. Short fills would not have mattered if she didn't have a periapical lucency and symptoms, right? Remember Dr. Lin's study? In this case, short fills means that this dentist who did the root canal left necrotic tissue and bacteria behind. So bacteria is what's causing the infection, and not short fills per se. So the reason this root canal failed is not because the canals were obturated short, but because the dentist left necrotic tissue and bacteria behind. And possibly, perhaps, maybe missed canals. So, as I said, patient had trismus, and she had just started antibiotics. So I couldn't help her, especially since she's leaving to go overseas in a few days. So talk to the patient. Patient's gonna go have the tooth extracted before she left the country in a few days. Perhaps if the oral surgeon could sedate her, perhaps maybe then he can use a mouth prop and open her mouth and extract this tooth. But the moral of the story, as I said, is short fills here did not cause endodontic failure, but the fact that perhaps there may be missed canals or definitely necrotic tissue and bacteria. So, talking about short fills, look here. This root canal was done over 10 years ago, according to the patient. Patient has no issues, no symptoms. As you can see, no periapical lucencies. So, short fill by itself cannot cause endodontic failure. If you leave necrotic tissue and bacteria behind, bacteria will cause infection and periapical lucency, not a short fill, not a long fill. So in this case, even though the canals were filled short, but because no bacteria is within the root canal system, even if pulp tissue was left behind, because there's no bacteria, this root canal is fine.